I'm going to share a description of another way that we offer training to veterinary students, both in surgical training and specific training in development of expertise in shelters beyond what they need to know for community practice, and also talk about how our advanced training programs for residents and practitioners interlink with our student training programs. The North American Veterinary Medical Education Consortium has called out some critical issues about the status of training veterinary students. And this has been mentioned this morning, and there's some 5 key components that have been objectives that they believe we need to address urgently in the training of veterinary students. So we need to graduate career-ready veterinarians that are educated and skilled in a standardized set of core competencies, and a lot of these are the competencies that we've been talking about today that practice-ready veterinarians need to be able to do, to ensure that all of our processes from selection of veterinary students to training to licensing are driven on a competency-based set of criteria, to become more cost-effective in how we're training veterinary students. This is a huge concern for us in Florida, as it is everywhere, that we're graduating veterinarians who have debt loads that are not compatible with their lifetime earnings potential. And to make sure that our new programs are more sustainable, and really to have a call to action to make this happen, and to stop just talking about it. And one way that we can start addressing these is by finding more efficient partnerships like we've heard about today in Oregon. So the current challenges that I see in providing these are the rising cost of tuition, and the tuition is rising at our institution because our state funding is plummeting, and we have to supplement what we used to get from the state. Our employers increasingly must have new graduates that can come in and make money for them, that having a long mentorship period that will eventually result in a veterinarian that contributes to the practice financially isn't acceptable anymore because they're working on such a small margin. And also our veterinarians move around a lot more, and so our practice owners are telling us they're not willing to take someone on that's going to lose money because they're probably not going to still be with them when they actually are more efficient. We've all experienced this as well, that our teaching hospitals are becoming so advanced that we're not bringing in the case material to provide our veterinary students with the general practice experience that they need. Like, I'm really proud that we do dialysis and radiation therapy and some other things at our college, but there are not very many general practitioners who are going to benefit from that training other than knowing that they can refer. Traditional terminal surgery labs that we've relied on for decades to teach surgery practices are becoming just economically unfeasible, and also society is challenging us not to treat animals this way. At the University of Florida now, the required small animal surgery course is all spays and neuters for local rescue groups and shelters, but our advanced surgical electives, which most of our students do take, is still a terminal surgery lab in dogs. And that is just becoming very politically risky. There's more attacks on veterinary schools for offering this. And I think it's quite an ethical challenge to say that we have to kill the animals that we plan to serve in the future. And I think that we can find alternatives, ways to train veterinary surgeons without killing animals. Small animal veterinarians receive very little training in the herd health issues that we are now asking veterinarians to serve in the humane community. It is veterinarians that local law enforcement agencies are going to go to if there's a cruelty case, and yet most of us have never received any training in how to do a forensic exam or testify in court, or to respond to a disaster if that's the case, or to deal with a distemper outbreak. I practiced internal medicine for 15 years, and I never saw a case of distemper, ever. And now in Florida, every week we're dealing with another distemper outbreak that we're trying to consult on, just in Florida, and then we also get calls from the rest of the country. And I had no idea this was always going on out there in the field, because there used to be such a separation between what private practice veterinarians were seeing and what the shelters were seeing. And why it's emerging now, is it really a re-emerging disease? That's possible. or are they just shelters just keeping animals longer and not just killing them all at the end of their required hold stay? So now we can see the manifestation of disease spread within a shelter. But it is quite stunning to me that there is this much disease out there that I had no clue. And the good news for our profession is that as shelters become professionalized, as you can see this great example here, is it's a great place to get a job, either in spay-neuter clinics or as shelter veterinarians in facilities like this. The job market in private practice is tight right now, but there is a huge unmet need in these kind of facilities for well-trained veterinarians. There's usually about 40 open positions advertised on the shelter vet listserv at any one time. And a lot of these are very high quality positions with good salaries. So talk about the training programs we have at the University of Florida. We have programs specifically focused on training of veterinary students in their core surgical and medical skills. So this would be teaching basic surgery or teaching outpatient medicine type procedures to the veterinary students using shelters and rescue groups as the source of the animals. So we have two ways that we teach spay and neuter. One is our feral cat neutering project, which I'm going to talk about in some detail, which is a collaboration between the nonprofit local spay neuter group and the veterinary school. So it's actually a nonprofit program that's based at the vet school. It's not directly run by the vet school. And then Dr. Zasa in the next presentation is going to spend a lot of time talking about how the details of how we run the pet neutering program at the college. So it's a little different. We don't send our students out. We're doing this training at the college, but using shelter animals to do it. And that's her clerkship rotation. And then we also have an extensive program that prepare both veterinary students and future specialists in shelter medicine in particular. So we're not just using the shelter for basic training, but we're trying to train up a specialty. And you may not know that there is a move afoot to create a formal specialty in shelter medicine, and we've already developed criteria for residencies as well as criteria for the competencies that shelter veterinarians would need to have, and that application is working its way through the system. So let's talk about Operation Catnip. This is our feral cat TNR program, which is a trap, neuter, return program. It is based at the vet school, so we use the surgical space at the vet school and some storage space, but that's all the veterinary school provides for us. The rest of it is run by a nonprofit organization. And I do receive requests occasionally from other schools for more information as they seek to provide more of this opportunity. We have the folks from UT here who we've definitely been in touch with, and several others, looking at this as a way, an affordable way to provide more surgical training and to answer their own community's call for the veterinary school to be more active in local welfare issues. This is what our program looks like when we take over on a Sunday every month, the surgery teaching lab. The objectives of this experience are, one, of course, we're mission driven, so we want our veterinary students and our veterinary school to be more engaged in the community. And this goes all the way up to the president of the university. His wife is active in local animal welfare activities, and he is, as a sort of his point of view is that there should be very good town-gown relationships. And so these kinds of programs, he believes, serve that need. So a partnership between a nonprofit agency, local residents, and the college. And we want to teach our students what is called high-quality, high-volume spay-neuter techniques. Of course, and hone their surgical skills, including pediatric neutering. Our students actually volunteer for this program primarily because they want the surgery experience, and we use that drive to teach them more about the problems of pet homelessness and how they are uniquely able to contribute to solving these problems. And we do, as was mentioned earlier today, the investment we're making now is for immediate service to our community, but more, the reason we do this and spend so much time and weekend work doing it is because we want to grow a whole generation of veterinarians who understand the needs of shelters and homeless animals and will become better partners at solving it rather than continuing some of the antagonistic relationships between shelters and the veterinary profession in the past. So the players in our particular model are Operation Catnip, which is the nonprofit group. This group is responsible for raising all of the money and providing all of the supplies and the volunteers and bringing them to the vet school. On the other side is the College of Veterinary Medicine, which provides access to the space and some storage space for supplies. And then a unique feature at our school is that I'm a faculty member at UF and I'm president of the nonprofit group. And so having someone who understands the needs of both sides really has made this work very smoothly for us. I don't think you have to have that relationship, but definitely the leader of the nonprofit group needs to talk very well with the faculty member who's going to be assuming responsibility for what goes on at the school, because the dean will certainly want a faculty person to take the lead. The required resources for a program like this, you need to have a veterinarian running veterinary programs, even though we have good access in many cases to good managers. I do think this is a medical program. It needs to have veterinary leadership, setting the standards. It needs to be very clear what everybody's roles are, and when there's complaints or problems, who's going to deal with that and how they're going to do it. You know, in our program, we neuter about 250 cats once a month in one day at the vet school. So there's a large number of cats that are coming in, having surgery, and being returned to the community at the end of the day. And we don't do most of the trapping. Most of the cats are just brought in by residents. And sometimes we get somebody's pet cat that comes in, gets neutered, and goes home missing part of its ear as a signal, and someone might call the dean when that happens and complain. So there needs to be very good communication for how both the good and the bad communication is going to happen. You need a good surgical facility. We have an extensive procedure manual, which we're very happy to share with anyone. I'll talk more about that in a little bit, but it's step by step for every activity that happens at the vet school, including how much supplies you need, where to get them, and how much it costs. The funding is the responsibility of the nonprofit group, which is primarily driven by grants and donations. It does cost us about $30 per cat that's processed. And this includes, we have 1.5 staff members, we buy all our disposables, we buy traps, pay the phone bill, everything else, if it's all divided by the number of cats we do, it's about $30 a cat. And we offer this free to the public. And then there's the fixed equipment costs. And then emergency care is very important. There has to be a plan for how to deal with cats that are having a problem after the surgery is done and they're returned to their caregivers. So in some programs, that's an arrangement with the local emergency clinic. In our particular program, I carry the after-hours pager, and so caregivers who are concerned about their cats recovering or who suffer a surgical complication will call me, and then we take care of it. The guiding principles are the Association of Shelter Veterinarians, Standards of Care for Spay-Neuter Programs. I was on the committee that developed these, and if you haven't seen them, I'm very happy to email them out to you, or I can provide a link. They're on the Association of Shelter Veterinarians webpage as well. When we developed these standards, it was because we were concerned about some of the quality of care that was being offered at some spay-neuter programs or in some private veterinary clinics. Like, we have a practice in town, former president of the FVMA, who opens up one spay pack and spays all the cats that morning out of one spay pack. And you know, that's just unbelievable that that's still happening, but I think it is probably many places. And we don't think that's appropriate. We want to elevate the standard of care. And so I think this is an excellent document to make sure that all of the programs that you work with are meeting these standards. So how's the clinic organized? It's a free spay-neuter clinic that takes place at UF one Sunday each month. It's for local community cats. So anyone who is feeding a stray cat or knows about a stray cat, they don't even have to be feeding it, can make a reservation, get a trap from us, and bring the cat to the clinic that morning. The Operation Catnip nonprofit group is going to handle all of the arrangements for getting those cats there. And they're brought to the vet school in the morning, we do the surgery, and then they're returned to their caregivers in the afternoon to recover overnight. And if they look good in the morning, then they're released back at their trapping site. And as I say, our goal is to do about 250 cats in a single day. The staffing comes from the community and the vet school. So aside from our 2 paid people, everybody else is a volunteer, including the veterinarians, veterinary students, and lay staff. They do sign a standard UF volunteer release, so we're covered as far as any liability that the university might have. If they have any contact with cats, we require that these volunteers be vaccinated against rabies, and this they do at their own expense. Because we have so many veterinary school volunteers, most of those will be vaccinated because they have to be to go to school, but we do have volunteers from the community that actually spend $600 to get vaccinated so they can volunteer in our clinic. And we do have a formal orientation and task training process. So the students can't just walk in and do surgery. We have standards for when they can do different surgeries. And remember that doing spays is the pot of gold at the end of the rainbow that they're all looking at, but they don't get to go straight for that. So they do have to learn the overall clinic flow and volunteer at other non-surgical stations before they earn the right to do surgery. Once they've completed their sophomore surgery elective, they can neuter cats. And then after they've done some form of surgical clinical rotation, then they can do spays. So that might be the shelter medicine rotation or the soft tissue surgery rotation or even an externship at a spay-neuter clinic. The supervision of the students is very interesting because we used to not allow the students to do spays because I only had a few volunteer veterinarians and we were doing hundreds of cats. I really needed my veterinarians to be doing surgery, not supervising students because, as we've already heard, students are slow. And the students were so desperate to do surgery that they said, what if we go out and we find supervisors for us? And what they came up with is they actually use SCAVMA money, which they get from selling the Hills pet food in to the college. And they pay surgery residents or other veterinarians from the practice world or from the vet school to supervise them. And they hire 2 veterinarians at $200 a piece every Sunday. So this is quite a commitment these students are making using their own money to make sure that they can have access to this surgical experience. And so usually there's 5 or 6 students assigned to neutering the cats and then 10 to 16 students doing spays. And if it's their first time, they're paired up with a more experienced student. So I'm going to go through just the steps of our clinic now to show you how it works. To get this many cats done, what works for us is to have a series of fixed stations, and the cats actually move through the process, whereas the volunteers stay in one place and do the same thing over and over again. So it is like a factory. It's like building a car, and it works for us because we never deviate from the process. So we don't take any special requests. Like what we'll talk about is the way these cats are identified is by removing the tip of an ear, and if we get people that don't want their cat's ear tip removed, then they don't get to come. Like it is one size fits all. We are focused on doing very high numbers because we are trying to reduce cat euthanasia in our community. We want to keep it as stress-free for the cats as possible. A lot of these cats are actually feral, so they're terrified by this whole experience, and keep our costs down. So safety first is very important. This is what a feral cat looks like when you look at it. They want nothing to do with you. They are extremely dangerous. They can fit through a hole about this big somehow, and you don't even see them move. It's just like this blur, and then you look down and there's blood dripping off your hand. You don't even know how that happened because it didn't seem like the cat could touch you. So the way to safely handle feral cats is never handle them when we're awake, and we never have bites. The only time we have a cat bite, even though we do thousands of cats a year, is if there's a cat that's like vomiting and someone under anesthesia and someone's trying to clean out its mouth and they accidentally impale their finger on a fang. But we don't ever have somebody getting bit trying to handle an awake cat. We also require that everybody wears gloves at all times, even if they're just doing paperwork, just to try and reduce any contact with what the cats may have on their fur. And then also, what we require is that all the cats come in these traps and then they get injected right through the side of the trap while being restrained by one of these forks. And that minimizes the stress for the cat. I've seen other programs where cats come in any kind of container and it's harder to inject them, so it takes more time, more handling. Or if you're trying to transfer a cat from a cage or a crate into another container, that's when they get loose and then you're chasing them around with a net, and it's very frightening for everybody involved. So at 8 o'clock, the cats come in. They've all been reserved already, so we know they're coming, and we generally get about 2/3 of the cats we have reservations for will show up, because not everybody can trap the cats that they have. But they've already rented traps from us. We have about 400 traps in our inventory. People pick those up the week before. We do say verify that the cat hasn't been fed, but it's important to recognize that the cats were trapped the night before using food, so a lot of them will still have food in the trap, and we just don't want to see a huge pie plate of food, which we sometimes do. We only allow them to come in these wire containers, and we use a numbering system that's very effective for preventing mix-ups of cats. Every cat has its unique identification number that starts with the year it was done, and then they're just numbered sequentially. So there'll be 2 sticky tags on top of the trap that when we admit the cats, one stays on the trap and one's going to go around the cat's paw, and that's how we get the cat matched up to its trap after surgery and then put back to the right caregiver at the end. We try to get money out of people. It does cost us about $30 per cat, and we're just not very good at doing this. Our average donation is about $5 per cat, and we've not budged that. And I did have the chance yesterday to visit with the Feral Cat Coalition's clinic, and they're much better than we are at getting caregivers to give more money, so I think we need to work on our scripts a little bit. And we tell them when to come back and get the cats. What we do is it's just first in, first out, so there's staggered intake time, and then that will tell them when to pick up the cats. This is what the waiting area looks like. So when the cats are all brought into the building, it's just a mass number of cats in traps. And then the corner there, you see where the anesthesia station is working. We use TKX, which is telazol, ketamine, xylazine. This combination works really well for us. It's very predictable. We have a very low rate of complications. They don't vomit very much. Like, we just love it. We have done some research where we've monitored physiological status of the cats. They do tend to have some pretty frightening levels of hypotension and hypoxemia, which we know about, and we would like to move to a more reversible dexdomitor-based anesthetic, and we've just not found the perfect cocktail yet that we can really ramp up to a clinic that has this many cats. If we're doing 20 cats at a time, we can use dexdomitor-based protocols, but when we go up to 200, there's these few cats that have very excited hyperthermic recoveries, and when those cats start screaming, it destroys the whole clinic flow, and the volunteers freak out. So we're still working on this. It leaves a lot to be desired, but it is incredibly reliable for us. And we give the cats, all the cats, including the males, get buprenorphine at recovery. This is the cat identification that I talked about. There's these twin tags here. And so one of these is going to come off and go around the cat's paw, and the other one will match the trap. Transporters are what make it work, so we don't want anyone leaving their station. So we have volunteers that just move a cat from one station to the next over and over again. And then pre-surgically, we give, all of the cats get a dual penicillin injection. We can debate the pros and cons of perioperative antibiotics. We think that they're valuable, but we recognize that not all programs will use these. If you are going to use antibiotics, definitely you need to give them before surgery and not after. All of the cats get their eyes lubed, the females get their bladders expressed. All cats get an ear tip, and this is really important if anyone is doing feral cat work, because these cats are going to be released back into the environment. We must be able to tell if they're already neutered. These cats will have a lot of different people that come and interact with them, whether it's animal control or different caregivers, different veterinarians, and if everybody's using a different kind of symbol to mark these cats, it can become very confusing. Some programs will use a notch, which we find is somewhat frustrating because cat fights, cat fight wounds can look like an ear notch. So we just put a hemostat across the tip of the ear, cut it off with scissors. That's what it looks like post-operatively, and then when the cats are back in their colony, you can easily tell who's been neutered and who still needs to be neutered. And all of our cats get scanned for microchip. Very few cats have a microchip, and if they do, it usually traces back to a humane society of some kind, and it's a dead end for finding the owner. Neuters, we do a standard closed castration. If a cat is cryptorchid, we send them through the line that's going to be prepped for a major surgery, and we teach the students how to confirm whether a cat's been neutered or not by looking for spines on the penis, and it is so great that cats have this little biological indicator for whether they've been neutered or not. And the veterinary students do all of the castrations. Spay boards are what make it possible to move the females around, and these are little boards that we make out of plastic ourselves. And if you have a system that requires moving cats after they've been prepped, these are wonderful because it allows us to have cats that are prepped and waiting for surgery, so we keep our surgeons always working. And you'll see we do both flank spays and midline spays. All the lactating cats, we do flank spay approaches on. Cats are prepped in the normal way. And then our spay surgeons really control the pace of the clinic. We want our surgeons always to have another cat that is ready to go, but it can be tricky to control the pace, especially with it's all injectable anesthesia. We don't want cats to be building up and using up their anesthesia time waiting to get to a surgeon, but we also don't ever want a surgeon tapping their toe waiting for a cat, because this dictates how many cats we can get done. Really, all that should happen is the surgeon change their gloves, and there should be an assistant there that brings a new cat, takes the other cat away, opens their pack. Every cat has its own autoclaved pack and new suture and new blade. We spay everything. The only cat that will not be spayed in our clinic is one that already has a kitten in the trap. So if they're in labor and they have a kitten out, then we'll say, okay, you can have your kittens and you'll go to a foster home. But if you are in labor and haven't produced a kitten yet, or lactating, or anybody else, they all get spayed. The cat overpopulation in the South is truly an amazing thing. And there's just no way we can justify bringing more kittens into the world while our shelters are killing sometimes 90% of 10,000 cats that enter each year. We give vaccines. Because our vaccines are donated, all of our cats do get a dose of FELV. That's part of a combination vaccine, but if I had to buy vaccine, we wouldn't be putting FELV in there because it probably doesn't do much with just a single dose. And we do teach our students to make sure that they're giving vaccines in the recognized AAFP sites. And then post-surgically, they give Revolution or Advantage Multi, whatever happens to be donated at the time. If we're not getting anything donated, then they get ivermectin. We can give fluids to the cats. We attempt to reverse the TKX anesthesia with yohimbine, but it's not that effective. A negative aspect of using TKX is we have long recoveries, and the cats can be sent home more sleepy than we'd really like. And then they get their buprenorphine. All of our cats have an individual medical record that's recording everything that's done to them, and anything special. We do a lot of research and outcome assessments with our cats, so this also captures a lot of data. This is a convenient way to do the paperwork. We have the top form actually captures what's needed for a rabies certificate, and it's a two-part form, so the caregiver is going to go home with the second page. They get all the information about their cat, so their vet would have that information if needed, except that on the second page, we'll block out who the surgeon was and whether the cat was pregnant, how many fetuses it had. But they get all of the other information, and on the back of that form are the discharge instructions and the emergency contact information. Because we use our instruments only once a month, we've opted for getting cheap Pakistani instruments, so we have 150 spay packs, and then we bulk pack the neuter instruments and the ear tipping instruments. The only exception is that we'll get sort of a mid-range, I think Polish or something, needle holder, but everything else is really cheap. So it keeps our costs down, and the instruments are all repacked as we're going. We have the big autoclaves at the vet school, so we'll start autoclaving right away. So if we need to, we'll have packs that were reused in the same day. And then in recovery, this is where half of our arrests occur. So it's very important that the volunteers working in recovery, watching the cats, understand that this is a high-risk time for a cat. And I think that needs to be emphasized in these programs, because lay volunteers just naturally assume that the risk is surgery. And really, we have very few arrests in surgery. If we're going to have a problem, it's right at induction or during recovery. And we do always try to do CPR, and if we can get to the cats right away, if their arrest was purely due to anesthesia, then we can usually save them with good neurologic recovery. Discharge, here's the family returning from church to pick up their cats. You can see how attached these caregivers are to their cats. This is why we believe that trap, neuter, return programs are an appropriate way to manage cats, because the people who are interacting with the cats are really concerned about their welfare, and they won't help with programs that are putting the cats at risk for just being culled at the shelter. So they do receive the emergency contact information in both written and oral form. They're told to leave the cats in the traps overnight in a warm, quiet place, check on them periodically, and then release them to their colony in the morning if they're recovered. If they're not fully recovered, then they call me and we have a look. So by the numbers, so far we've had almost 500 veterinary students that have performed 14,000 surgeries since 2002 when we added the spays to the student itinerary. And this is a completely voluntary program, and 64% of all the veterinary students who have come through the college since that time have volunteered in the clinic. Our complication rates are actually better than what are reported for private practice. Our overall mortality rate on the day of surgery is about 1 cat per 500, or 0.2%. What we don't know, because the cats are released, is how many cats get sick or die after they're released. And our recheck rate is about 1 cat per 300. So every other clinic or so, I'll see a cat back that's dehydrated or having another problem. And interestingly, there's no difference between the students and the veterinarians in these complication rates. There's several explanations for that. One is the really good supervision and training that they get. Another is a lot of the veterinarians that volunteer are actually from the college. And if you have an anesthesiologist or a pathologist that decides they want to brush up their surgery skills by coming to our clinic, they're not always the very best, most experienced surgeons. So we have people who haven't spayed in a really long time. The cost of the college is essentially free. Whatever you might think of as overhead costs for the storage space that we have or having the lights on a Sunday are really the only cost to the college. So we've provided 14,000 training surgeries to students with no cost to the college. We do have some student record holders. These are the ones that obsessively volunteer from the time they get into vet school. And these are the numbers for our top spaying students, how many they did during their time at the veterinary school, and the top neutering students. So if a motivated student can get hundreds of cat surgeries under their belt before graduation. These really motivated students also, because our surgery skills become so good when we have special surgeries like enucleations or amputations or other things that we're going to do, we'll let those students take on those surgeries. We are really proud of this program and what it's offered to UF students, but we recognize that most colleges can't offer this, and in the past we've not had a way to integrate students from other colleges in this program. So what we're offering this August for the first time is a course. It's been approved for credit from the college, and it's a week-long course, an intensive 5-day, all-day course, which is essentially going to be like a mini catnip clinic every day. In the mornings, we're going to have lectures about all topics in surgery and community cat management. In the afternoons, we'll have one of these clinics. And so the students will rotate through all of the stations. They'll actually go out cat trapping, and they'll do a lot of surgery. And we have some veterinarians from the Humane Alliance who will be coming to help us in this course. And so this course is open to both our own students and to students from other colleges. So if you know of any students who might like to participate, we have a little website where they can sign up. That'll be this August, and this course is funded by PetSmart Charities, and you'll hear more about the PetSmart Charities spay-neuter funding options during our meeting here. So we're really proud, and we're sort of evangelical about this program. We encourage you to call us, either our executive director or myself, for information about this. We have our existing operations manual on CD that we can send you, but we're also funded by PetSmart Charities to make a mentoring website. We're working on that now, so you'll be able to go online and see every step of the process for running one of these clinics, including all of the volunteer training stations. So when a volunteer is going to be assigned to a new task, then go to the website, see a little video and pictures about what their exact task will be. So that's our kind of partnership with a nonprofit agency that provides training opportunities for veterinary surgeons. And I'd like to now talk about some of our other shelter medicine programs that address both student education in shelter medicine and integrate into the training of specialists, which are also part of our program. So, this picture here at the top shows Kitty's one day's take at our local animal control. Luckily, a few years ago, we don't euthanize as many cats as we did then, but certainly most of the cats that come into our shelter are still euthanized. And you can see in this picture, these aren't cats that are being euthanized because they're sick or suffering. These are anything from newborns to big adult cats, but they're fat and glossy. They're euthanized because their cages need to be opened up that day because more cats are going to come in. And that's why we're addressing these problems. And then especially in the South, we have huge problems with infectious disease outbreaks in shelters. And shelters have a long way to come to really professionalize and start serving animals better. There's about 8 to 10 million dogs and cats that currently enter shelters, and nationwide, it's not like Portland. At least half of the cats and dogs in shelters are euthanized, and sometimes quite a bit higher. We're also trying to teach shelters that responsibility for the health and welfare of animals in the shelters really is a veterinary responsibility. We want to elevate the stature of veterinarians in shelters to be a more managerial level. Right now, shelter veterinarians are frequently the highest paid professionals in a shelter, and shelters want to use them to do spay and neuter and won't let them out of the OR frequently. And so they're missing this great opportunity to improve the outcomes for their shelter animals by not using them as for shelter medicine. But we do know even when people do hire a veterinarian to work in their shelter, there's often significant knowledge gaps that veterinarian may have for how to manage a population, because that's not taught in veterinary school. So we've developed coursework for students that are electives in our curriculum, and these courses have all been approved. And if students complete 15 units of elective credit, they graduate with a certificate in shelter medicine. It's the 4th certificate program at UF. We have certificates in food animal medicine, aquatic animal health, and international veterinary medicine. So this is the only college in the country that has an official document that will be on their diploma at graduation that recognizes their focus of training in shelter medicine. And so there's a course that Dr. Zasa teaches on an introductory overview course on shelter medicine. We have disaster response course that includes completion of the FEMA courses that are required now to respond to a national disaster. Dr. Melinda Merck teaches a course on veterinary forensics. We have a veterinary behavior course that's taught by behavior specialists. And then we have all of our surgery training. We have a new clerkship that is focused on teaching students how to do formal shelter consultations. And this is going to be very interesting as we look. When we do our shelter consultations, we go in and we do population analysis and protocol review, and our students will be going with us on those consultations and contributing to those visits. We have and then they do externships and research projects. So this is a really big commitment for students to take on this kind of elective burden, and we have 22 students enrolled from all of the classes right now in this new certificate. We also have a residency, and these residents are amazing. These are our 3 residents we've had so far. They're enrolled in a 3-year residency program, I ran our internal medicine residency program, so it's all I know, and so we patterned ours very much after the internal medicine residency, which means that I expect them to work really hard, really long hours, 7 days a week, and to be very productive. And so it involves some rotations through specialty rotations, as well as doing shelter consultations, disease outbreak interventions, which we're constantly involved in, helping shelters develop protocols that are specific and useful for them, and doing research to create new knowledge. And then for graduate veterinarians, we have conferences for continuing education. We have an annual disaster conference, a shelter medicine conference, and a forensics conference. And this shows a wet lab that we had where we took cadavers from the shelter for a forensics conference and created all kinds of horrible wounds on these animals. And the participants in this wet lab had to do a forensic necropsy and then find the tool that was used for causing the wounds and writing up a forensic report. And so we have, for the students, we have the didactic curriculum in shelter medicine, and then we have the residents that are interacting with the students and going on consults, and then we have the continuing education for veterinarians. And our students, like all 3 groups, interact with all of these activities, so they're the students get exposed to a lot of different levels of shelter medicine, not just coursework. So this shows a group of students and residents doing one of our shelter consultations. It's always a big group that descends on some poor victim shelter that has invited us. So they voluntarily open up everything for us to look at, and the students participate in those. Disease outbreak interventions. This is Dr. Zaza with her clerkship students helping a local pet rescue group with a parvo outbreak in their little backyard rescue operation. And then this is looking at, we were called by the state veterinarian to serve as the managers of a quarantine of 220 dogs that were imported from Puerto Rico into Florida, as if Florida needs more dogs, but they were actually on their way to New York. But luckily they broke with their parvo and distemper outbreak immediately arriving in Florida, so they did not go to the giant adopt-a-thon in New York City. And so our team was down in South Florida for a month managing this outbreak and trying to save as many animals as possible while housing them in a warehouse under very challenging circumstances. Because we have a lot of disaster response equipment, we brought that down and could set up a lot of isolation units in the different agencies. And so we keep data, and this is our residence analysis of the trends of the parvo, which appeared first, as you would expect, and then how long it took for us to finally clear all of the distemper. We've been involved in several large-scale cruelty investigations and responses. This was a sanctuary, and whenever I hear the word sanctuary, I get sort of chills down my back, but this is a typical sanctuary for cats. They had 600 cats cared for by a single person, and you can imagine what that really looks like, and really it's just large-scale hoarding. And so our students and our residents came down and managed that scene for the better part of a week. This is just some other scenes from, there's the group at the hoarding case. We do also cruelty investigations for our cruelty exams for our local animal shelter, and so this shows Dr. Merck helping some students in our intensive care unit where this extremely anemic and starved pit bull is being cared for. And so she's documenting or helping the students learn how to document a cruelty exam. And this case did go to court, and we got a felony conviction with our residents testifying on that one. And here's some students involved in evaluating dogs that were seized in a dogfighting bust by another shelter. Again, continuing education, this is that wet lab where veterinarians and veterinary students were all doing forensic necropsies. We have a disaster response unit at the college, and we're part of the state's disaster response team, and they may right now be being deployed to other parts of the South that are needing to have disaster response units, but we can go in and assist with either large cruelty cases or natural or man-made disasters. And we have a number of disaster drills each year that people participate in from the college, including training and how to do technical rescue of large animals. And the scene they're going to do this year is a mock scene where a horse transport unit overturns, and they're going to be hauling horse mannequins around and have some live horses as well. And then we're very fortunate to do a little bit of international work. We also take the residents and the students on these trips when we can. This is the one we just did in rural India at a Tibetan refugee camp where they have a big problem with rabies. So we went to do a rabies vaccine campaign and look into establishing a neuter project in that Tibetan camp. And you can see how needy those animals are. And at the same time, we're collecting information for research. So we did household survey on how people feel about the community dogs as opposed to their pets, and took blood samples to come back and look at some zoonotic infectious disease research. And this is how glamorous a roadside vaccine campaign can be. So what does this all take? As we heard earlier today, these are very resource-intensive programs to manage. They're incredibly rewarding, and the students love them, and our local community is bonded to our college because we're offering this, but they do not come cheap. So our resources come both from the college as well as from the nonprofit sector. There is our college supportive resources. So there's two clinical track faculty. It's Dr. Zaza and Dr. DeGangi, whose salary comes mostly from the college, and are there for the clinical clerkship that Dr. Zasa is going to talk about. The teaching funds, which are quite minimal nowadays, most of our teaching funds have been lost due to budget cuts, so they're supplemented by grants, including PetSmart Charities, which has been one of the donors that's been generous, as well as service revenue, so they get, you know, a pittance from the rescue groups for doing the spays and neuters, but it does help with some of the disposable supplies. And then they also partner with a local nonprofit group that provides indigent care for local pet owners. And then we have grant-supported resources, which are my half of the shelter medicine program, which is funded right now by Maddie's fund for the most part. We have 3 more years on that grant. So they fund 2 faculty members, myself and Dr. Crawford, our 3 residents, 2 staff members. We're supposed to be generating a lot of service income from our shelter consultations, but there aren't any, nobody has any money anymore. So generally we scholarship all that, and our grants pay for that. We work with the Operation Catnip Spay Neuter program. All of our research is funded by grants that we get from research agencies. And then I talked about the 15 credit certificate program that we have for our veterinary students. We recognize that there's just not enough nonprofit funding to go around to start a formal shelter medicine program like this at every school. So we would like to put our certificate program into a distance learning opportunity so that students from other schools can take this same great content that we have and receive kind of like a mini degree in shelter medicine. So that's our big project for the next 3 years. We have a website which I invite you to visit to learn more about our program. And of course, I wouldn't be here if it wasn't for Maddie's Fund, so we're very grateful for them for being so generous with us. I'd be happy to take any questions.